Welcome to the COPD Foundation podcast. We bring you insights from leading health professionals, inspiring stories from those living with lung conditions, practical advice, and the latest in lung health research. Be sure to subscribe, follow us on social media, and visit copdfoundation.org. Take action today, breathe better tomorrow. Just a quick note before we jump into our topic. This podcast series was created for educational purposes only and is not a substitute for formal medical advice. Talk to your healthcare provider if you have any questions.
Every breath you take is something that most of us don't usually think about until it's hard to do. Over 16 million Americans have COPD, and many more don't know that they have it yet. New research is important for better treatments and earlier diagnosis. Right now, NIH funding for COPD research is lower than for other chronic conditions. I'm Jonnie Korinko, an educator from the COPD Foundation. In this episode, we talk with two experts about why this funding gap matters and what we can do to help. So guys, can you please introduce yourselves to everyone? Tell us about your experience with NIH funding and why it matters.
Sure. Thanks, Jonnie. Happy to be here. My name is McCrary, and I'm the Senior Manager of Advocacy and Public Policy and the Captain's Program Coordinator at the COPD Foundation. I manage our team of grassroots advocates by directing policy campaigns and engagement for these advocates across the country. We work with the captains in our Captain's Program, and I help everyone learn how to advocate for the COPD Foundation's policy priorities, which includes supporting NIH funding.
Hi, my name is MeiLan Han, and I am the Chief of Pulmonary and Critical Care Medicine at the University of Michigan. I'm also a board member for the COPD Foundation, have been involved in a lot of NIH related projects, and I'm also a spokesperson for the American Lung Association. So I'm very invested in this topic and excited to talk with you about it today.
Thank you so much. And for those of people who are listening but don't quite know what we're talking about, can you just define, what are we talking about when I say NIH funding?
So there may be a lot of people that don't understand sort of how research gets done in the United States, but historically, we've been very fortunate in that we have sort of this crown jewel called the National Institutes of Health. And they have a lot of in-house physician scientists, a lot of in-house scientists and programs to support research across the spectrum. But they also fund a lot of external research, mostly through large institutions like universities. And I think many people are aware that over the past year, NIH funding has really been under attack from the central administration for really, it's been sort of multiple different kinds of blows to threats to something we call indirect costs, which are costs that are added on to funding proposals to the NIH that help to fund sort of infrastructure. And really the size of many of the grants to the NIH have not gone up in 20 years. So institutions really depend on those indirect costs to pay for keeping the lights on and equipment and some of the hidden costs it takes beyond just sort of the more direct costs of a project itself. So that's been under attack. We've had a lot of random programs that have been canceled for a variety of reasons, whether the subject matter has not been in line, say, with central administration, but we've also had entire projects cut for other random reasons. So, for instance, the American Lung Association Lung Health Cohort was funded through Northwestern, and Northwestern lost the majority of their federal funding, so that program is down. And then they also made, many people may not know, they made an across the board 35% to all contracts. And several years ago, two of the biggest signature projects in COPD that are funded here in the US, their two projects are called COPD Gene and Spiromics. Those were switched to contracts. So both of those projects were subject to the 35% cut. In addition to just the NIH funding sort of being questioned and in jeopardy in general. And I don't even know, to be honest, where it's going to land because we don't have a budget for next year. So and that is all on top of the fact that to begin with, COPD was already somewhat underfunded. So just lots and lots of threats to, finding new treatments and understanding this disease, generally speaking.
I just would also like to add that the threat to NIH funding is so significant because the NIH historically has delivered such an outsized return of investment to the United States economy. It's estimated that for every dollar invested in the NIH, it generates $2.56 in economic activity. So there's many economic incentives to not cut this funding. The NIH has accounted for 50 to 60% of all basic research funded in the United States. And NIH-funded research has contributed to approximately 99% of drugs approved between 2010 and 2019. However, because Congress funds all but 3 of the NIH institutes, we as Americans have the responsibility to urge our lawmakers to continue to ensure that NIH is funded at an appropriate level.
What I'm hearing is that, really there are very close, timely impact, but long-standing impact as well. And even if you are someone who doesn't have a chronic condition, you might now or in the future be impacted by, detriments to NIH funding. Is that correct? Am I understanding that correctly?
Yeah, absolutely. I mean, nobody, in an ideal world, right, we all get through life and we're relatively healthy and we don't have any kind of health crises in any of our families. But the reality is, I don't think there's a family that's not been touched by some kind of chronic health issue, whether it's cancer or heart disease or lung disease or diabetes or, liver failure or kidney disease. I mean, there's so many things, right? And so at some point, you are going to need an expert for either yourself, your parents, your children, and you want to know that that best care is available. And for years, there's a reason that people from other countries across the world flock to the United States and our medical systems for care. And it's because we have really expert clinicians. I can't, not to toot my own horn because I don't think that I'm anything particularly special, but I cannot tell you the number of times where I have seen patients referred in from other institutions where the diagnoses were simply wrong. And that's really only possible really through NIH funded research. So it's not just this esoteric thing where it feels like distant, that it doesn't, impact me. It directly impacts every single American.
Absolutely. And even if you do manage for you and your loved ones to never have direct experience with a health condition or a disease, the NIH looks at specific experiences of populations like children, the elderly, environmental health, nursing research. There are things that don't have to do with specific conditions or diseases, but that still affect our entire population, communities, families as a whole.
When you think about like some of the really cool, exciting breakthroughs that we've had, GLP-1s, or CRISPR, or, the ability to get Operation Warp Speed and the ability to get COVID vaccines developed as fast as we had, the technology for mRNA vaccines, all of those have some kernel or some thread that ultimately ties back to NIH funding.
So specific to our COPD community, how has government-funded research changed the lives of people with COPD over the last 10, 15 years?
That's a really great question. So one of the new drugs that was just approved for COPD, and I'm just showing, there's actually 3, I guess, to be fair, I'll name them in case anyone's listening. There's PD3, PD4 inhibitor called ensifentrine. And then there's 2, I'm going to call biologics for type 2 inflammation. One of them is called dupilumab and one is called mepolizumab. But I was talking to some physician scientist lead at one of the companies that makes the one of the biologics and recently, and they were saying to me, we never would have taken this drug never would have risked all of the money. And I don't think people realize we're talking about billions of dollars for development of even one new drug. It's just that expensive to run the clinical trials and get all over the regulatory hurdles. They said we never would have taken the risk if we didn't have the data from the NIH studies first that laid the foundation to help us understand this patient population and where we thought the drug would be helpful. And that was directly from their mouths. So I firmly believe that the NIH funded work in studies like Spromics and COPD Gene that I've had the privilege of being a part of, and that the COPD Foundation has been a direct partner in trying to help fund, were fundamental for ultimately getting these new drugs across the finish line.
Thank you. So, what are the main missing areas that you see in research funding, and what do you think the main impact will be if they're not addressed?
This year, the presidential budget proposed for fiscal year 26, which started in October, but as Dr. Han mentioned, we don't have a budget yet, so not fully in effect. The president proposed a budget that would cut NIH funding by 40%, which is hugely, hugely significant. That was at the beginning of this calendar year, the beginning of 2025. Since then, as of right now, it's October 2025 as we're recording this. Both the House and Senate have published draft budgets for fiscal year 26, which reject the proposed 40% budget cuts. Certain programs in the NIH would still experience budget cuts under these proposals, but these cuts are significantly lighter than the cuts that were anticipated by many. We are still advocating to fully fund the NIH to the best of Congress's ability right now. If the NIH is not funded at a level where current and future research can take place, the progress that our country has made that Dr. Han was explaining as a leading source of medical research would reverse and would impact medical innovations for generations to come. Reducing the NIH budget so dramatically also risks American jobs at our renowned research institutions across the country.
How can our listeners better support research funding? Like, what would be your ask, Bailey?
I would ask for everyone listening to consider joining the COPD Foundation Captain Program. We advocate for better lung health policies like increased NIH funding, and we support our captains with resources, training, guidance, community updates for you to advocate in your own communities and with your lawmakers to support issues like funding for the NIH. It is a free program to join. There's no membership dues. There's no minimum hour requirements. We do things all virtually. You can do things in person in your community, but we do all go visit Washington, D.C. together every year to meet in person with our lawmakers and advocate for better policies for the lung health community. This is also an optional trip. You do not have to join if you're a captain, but we have so many good opportunities for you to join a really strong and wonderful group of folks that are already doing this work to make life better for your community. Even if you aren't a captain, you can visit our Advocacy Action Center on the COPD Foundation website under the Take Action tab to access a pre-written message that you can personalize and send directly to your lawmakers to urge them to support NIH funding.
That sounds like some amazing opportunities. I think that the real ask is just get involved, right? Whether that's through the captain's program, whether that's just through messaging your legislators directly, let them know that you care about the health of Americans and that you know that, continued funding of NIH, Medicare, Medicaid, virtual health, all these things really matter to constituents. As a clinician and an educator, just to say one more time, I worry so much about not just the health of my patients today, but the health of, the patients of tomorrow. What kind of world are our children going to grow up into? And I would hope that it is such an exciting time in science. Let me just say that again. We are really, I think, at just kind of on the cusp of really understanding the mechanisms for diseases. There are things that I have scratched my head about for years. Like, I don't know why this patient has this symptom. I don't understand. I don't really have treatments to now, at least for some of them, to say, you know what, I actually understand what's going on now. And by the way, I actually have something I can do about it. And so I think, just with sort of the information explosion, AI, it's changing how we approach diseases. And we are on the cusp of something potentially great. But we have to continue the investment if we want our kids to, I think, we could have cancer. Some cancers cured within the next 5 to 10 years. Things that when I was a child, we didn't even think were possible. But that's really only going to be possible with continued funding and support for the scientific and medical infrastructure that we have here in the United States.
Thank you guys so much for joining us today. If you have lungs, NIH funding matters to you because it helps advance lung research. Without it, progress slows down, treatments are delayed, and lives are at risk. You can help by visiting the COPD Foundation's Advocacy Action Center to learn how to contact your Congress members and ask them how to support more NIH funding. Together, we can help everyone breathe better now and in the future.
Thank you for tuning into the COPD Foundation podcast. And remember, whether you're managing a chronic lung condition, providing support to those who are, or just want to learn more about lung health, the COPD Foundation is here to support you. Be sure to subscribe to this podcast and follow us on social media. Take action today, breathe better tomorrow.